Hello everyone, this is a continuation of chapter 51. So we're going to continue to talk about diabetes, but this time instead of using a PowerPoint, I've researched a YouTube video that I thought it would be easy for everyone to understand what diabetic ketoacidosis is. So let's take a look at the videos now. The video is done by Mint Nursing. I'm not sponsored to this video. I just thought it's pretty easy to understand. Here we go.
Hello guys, welcome to this video. Today we will talk about diabetic ketoacidosis or DKA in 5 minutes. There are 5 hallmark signs that characterize DKA. They are hyperglycemia, ketosis, acidosis, dehydration, and electrolyte imbalance. But first, let's talk about the pathophysiology of DKA. Normally, we have glucose in our bloodstream. Now, our cells need glucose to function properly and to get energy. Now, for this to happen, our glucose needs to get transported from the bloodstream into the cell. And this is made possible by the insulin that is secreted in the pancreas. It binds to glucose, which allows the transport of glucose into the cell. Once the glucose is in the cell, then we have energy. So that's normal. In diabetic ketoacidosis, there's not enough insulin or there is no production of insulin at all. So the transport of the glucose into the cell does not occur. This results in elevated blood glucose, and because glucose is unable to enter the cells, there is no energy. To make things worse, the body will try to compensate by taking glucose from the liver and transporting it into our bloodstream. This happens because the cells are hungry. Because there is no energy, it thinks that the body does not have enough glucose. So now the body is still hungry for energy. So what it will do is that it will break down fats and convert it into energy. Now these energies are used by the cells. But in the process of breaking down fats and converting them into energy, the body produces ketones. And these ketones get stuck in our bloodstream. Now, this is what's causing our ketosis. Now, let's talk about the clinical manifestations of diabetic ketoacidosis. Now, these signs and symptoms occur because of these 3 occurrences. We have the cellular starvation, or the cells are hungry. We have the increase of blood sugar in the bloodstream, and the presence of ketones in the bloodstream.
So I do want to mention that the early symptoms of DKA is pretty vague, and it becomes more and more serious if patient obtain more and more ketones accumulated in the bloodstream. Also, that when we talk about blood sugar level increase, we're talking about elevated to almost 300 to all the way to more than even 1,000 milligram per deciliter. So we're not talking about 200 blood sugar level at 200 or 180. We're talking about something way higher than that. Okay, let's continue with the video.
First is the altered mental status. Because the glucose are not able to get in our cells, our brain cells are deprived of glucose and energy, which causes altered mental status. Some patients become lethargic and drowsy. Now, another thing is weakness. Our muscle cells are also glucose deprived, which causes weakness. Now, another symptom is polyphagia or hunger. Now, because our cells are glucose deprived, our cells will send signals that we are hungry. Another symptom is polyuria. This is the body's compensation to get rid of the excess glucose and ketones in the system. Now, here's the thing about polyuria. We're not only urinating the excess glucose and ketones, but at the same time, when we have excessive urination, we're excreting the potassium and other electrolytes in our system. So this causes electrolyte imbalance. The next is polydipsia or excessive thirst. Now, this occurs because of the polyuria. We are urinating too much, which causes dehydration. Again, the brain will send signals that we are dehydrated. Thus, the body will say that you are thirsty. Another symptom is the metabolic acidosis. Now, the body becomes acidosis because of the presence of ketones. Now, too much of these ketones are very toxic. That's why the body becomes acidotic. So a lot of patients, you'll see that their pH is less than 7.35. Now, another compensation of our body to get rid of the excess ketones in the system is through small breathing or small respiration. So this is what's causing the fruity breath smell and rapid respiration. You're going to remember all these clinical manifestations by thinking of those three occurrences: the hungry cell, the presence of glucose in the bloodstream, and the presence of ketones. Now, let's talk about how to care for a patient that has diabetic ketoacidosis. Now, there are three things that we have to focus on for a patient that has diabetic ketoacidosis. Number one is hydration. So when a patient comes into our ER and you see the signs and symptoms for diabetic ketoacidosis, you're going to establish an IV and hydrate with fluids right away. Initially, it's going to start with NS or half NS, depending on what the doctor orders. Now, once the blood sugar is near 250, switch the fluids to dextrose to prevent rapid drop in sugar, which may lead to cerebral edema. So the next priority is the electrolyte correction. Once the labs are there, you have to correct potassium if it's low. Now, if the pH is less than 7, then some doctors would order bicarb. Remember, the presence of ketones makes our body acidotic. So lastly is the insulin administration. So the doctor will probably order insulin drip for a patient. So the very important thing as nurses, what you have to do when a patient is on insulin drip is to monitor blood sugar level. To summarize the care for a patient that has DKA, we have hydration, electrolyte correction, and insulin administration. And that's it.
All right, so I hope you guys enjoy the video. The video is very short and brief to the point. I believe it touched upon all the key topics for DKA. One thing I wanted to just keep you guys be thinking about the medical management are the goals, right? So yes, these are the interventions, but what are our goals for our patient? So number one, we wanted to reduce our blood glucose level, right? So I mentioned before, DKA patients' blood glucose level is going to shoot out the roof. It's going to be somewhere above 300 all the way to more than 1,000, right? So we wanted to drop down the blood glucose level. Secondly, we want to correct the fluid and electrolyte imbalance. That's why we need to be monitoring the labs. When the video said to correct potassium if it's low, how do we know if patient have low potassium, right? We check the labs. But in between this time, we should also be putting on a cardiac monitor to check patients' heart rate and heart rhythms to see if there's any evidence of hyper or hypokalemia. Last thing is insulin drip or insulin administration. Patient with DKA is considered life-threatening, so we are no longer going to be just using the subcutaneous insulin administration. We're going to give it through the IV so that it will go into the patient fast and quick, right? So with the IV infusion must be monitored closely with the vital signs as well. Okay, so we will be checking their blood glucose level almost every 1 hour or every hour to see where the patient's blood glucose level is. Okay, so lastly, we will also want the goals to be clearing the ketones in the blood and clearing the glucosuria in the urine. All right, so we will also be checking that as well. Okay, so that's all for the DKA. I hope you guys enjoyed the video.